Hi, just relax on that electric muscle stim for a few minutes. I'll be right back. It'll relax those muscles. Hello again, I'm Dr. Paul Muscolino, and I'm going to continue. Before we showed how spinal adjustments can reduce spinal nerve irritation, help restore musculoskeletal stability, help balance the spine. We showed where muscles are related to organs and how by correcting one we're helping the other. Now I want to show you some of the modalities that we use. In addition to chiropractic adjustments, we also use different modalities of a physical therapy nature in order to help restore integrity in the spinal muscular structure. This one is called Magnetherm. It's a wonderful unit, and we're going to use it to increase the blood supply. If you recall, the spinal x-ray showed curvature of the lumbar spine and irritation in that particular area. We want to introduce more heat into the area, more vascularity, and this is the machine that does it. It increases blood circulation flow to the area we're trying to improve. If you use the moist heating pack, it may be an 1/8 of an inch depth. Here, this goes 1.5 inches deep into the tissue, so it really heats up and vascularizes the area we want to. Here, by using the Magnetherm on that area, we're helping restore normalcy in that region. We also showed how the circulation into the intestinal tract may have been compromised because we found weaknesses in what's called the ileocecal valve. So we're using this machine now to also restore better blood supply to that particular area. So Magnetherm serves the purpose of increasing circulation and helping musculoskeletal areas like the lower back, and later on with this patient we'll use it in the neck. And also we can use it for organ function, in this case helping the intestinal tract. And what we'll show you later, how the intestinal tract and the lower back get the same nerve supply, blood supply, lymphatic drainage, acupuncture points as well. So by helping one, we're helping the other, and this is part of that holistic triangle we described where structure, biochemistry, and psychological phenomena interrelate to each other, interconnect. Therefore, by using an integrated approach, by hitting on all three areas, we're really helping the body help itself. Okay. Our next therapy that we're going to use is called intersegmental traction. The interesting part about intersegmental traction is that it actually stretches the muscles and ligaments in the area. As you may know, aging is really drying up. It's getting stiff. It's getting locked or fixed. Fixation produces immobility. Life is vitality. It's movement. And what we want to create with the help of the intersegmental traction is to get more movement in the spine, breaking up some of these locked, fixed areas. Again, the problem is not only the lower back, so we certainly want to use the intersegmental traction up in this area or down in this area, and the cervical area, so we want to get more traction in this particular area. As we mentioned before, the spinal column houses and protects the spinal nerves, and irritation to the nerve produces a problem in the muscles, oftentimes showing in the area of pain. So what we're trying to accomplish is breaking up this fixation and again restoring normal nerve flow to the different parts of the body. And now we're going to show how this particular machine works. By putting it on like this, there are rollers underneath which are actually stretching those segments. So we're getting good stretch in the lower back and in the neck area. How does that feel?
Good.
Okay, good. So this is a very brief introduction of intersegmental traction, one of the modalities that we use to help restore normal mobility. Mobility is the key word. For further information, please call me at 914-725-4844 to find out more about the integrated approach using structural, biochemical, psychological integration. Or if you want to find out more about how the nervous system, using Oscar here, can affect your body through spinal nerves going to all parts of the body, again, please call me either for further information or to set up an appointment for consultation. Thank you for watching this video, and again, call 914-725-4844. I could be reached at that number for both my offices, either at 1024 Wilmot Road, Scarsdale, my main office, or 166 East 88th Street in the city.